It is estimated that each year 1.4 million children die from diseases that could be prevented by a simple step. Immunizations can save children's lives. Today I will give you 3 important reasons to immunize your child: safety, the cost, and disease eradication. The first reason today is your child's safety. Vaccines prevent many childhood diseases. There are many types of vaccines that your child should have before the age of 5. These include the MMR vaccine, which helps against measles, mumps, and rubella, the polio vaccine, hepatitis A, hepatitis B vaccine, the pneumococcal vaccine, which helps protect against pneumonia, the Hib vaccine, which is the Haemophilus influenza vaccine, the DTaP, which helps prevent against diphtheria, tetanus, which can lead to lockjaw, and pertussis, which can lead to whooping cough. There's also the varicella vaccine, which helps fight against chickenpox, the rotavirus, and influenza, which helps fight against flu. In older children and teens now, we offer the Gardasil vaccine, which helps fight against cervical cancer. They also have the meningococcal vaccine, which helps to fight against meningitis. Another safety concern is future generations. By immunizing your child, you are helping protecting the next generation against diseases. According to the medical news today, over the next decade, millions of lives could be saved by the simple pneumococcal vaccine to help prevent pneumonia. There is also myths about vaccines and safety. A British doctor named Dr. Wakefield claimed that the MMR vaccine, the measles, mumps, and rubella, was linked to autism. He went all around the world, and in 2000 he was in the United States and was on the show 60 Minutes. This made parents very scared to give their child the MMR vaccine. Since then, a reporter named Brian Deere investigated Dr. Wakefield's claims, and he has found that this was all false and was nothing more than a scandal. His findings were published in the British Medical Journal in January of 2011. He discovered that it was all a sham and that Dr. Wakefield was paid to create evidence against the measles, mumps, and rubella vaccine. There is no scientific link between autism and the MMR vaccine. The second reason I'd like to discuss today is the cost. Immunizations can help prevent long-term diseases and therefore will save you money. Even if you have insurance, it will not cover it all, and there will be out-of-pocket expenses that you would have to pay. If your child is healthy, you will be less likely to miss work and therefore have more money. For those of you that do not have insurance, the health department offers free vaccinations to children. So there is really no excuse not to have your child immunized. The third and final reason today is to help keep diseases eradicated. In 1979, according to the Center for Disease Control, Japan stopped vaccinating for pertussis. Well, this led to a pertussis epidemic and outbreak. They had 13,800 cases of whooping cough. This led to 41 deaths, which could have been totally prevented if they would have just kept on immunizing their children. Smallpox used to kill 5 million people worldwide. In 1980, Edward Jenner created a vaccine, and smallpox has been eradicated. Another disease is polio. Since the polio immunization came out, it has decreased so much that teens and young children do not even know what polio is all about. So immunizations can really eradicate diseases. So today I have given you 3 excellent reasons why you should immunize your child. Their safety, the cost, and disease eradication. Worldwide, 3 million children's lives are saved each year through vaccinations. The sad part is that we're still losing almost 1.5 million children each year. So please, make your child's health a priority and immunize.